Good evening, I'm Amitha Balachandra. We're bringing you this discussion because India has reported 4 cases of monkeypox, which is a viral zoonotic infection caused by the monkeypox virus. So, 3 cases have been reported in Kerala and one in Delhi. Both the states and Union Territory have said that so far these patients are stable. Now, more than 16,000 cases have been reported from 75 countries, and the WHO has declared the monkeypox outbreak as a global health emergency. So, this is what we're going to be talking about and focusing on today. How worried should we be, and what precautions should we be taking at this point in time? To answer all of those questions, I have Dr. Tanmay Mahapatra, epidemiologist, joining me right now. Dr. Mahapatra, thank you so much for joining us and giving us your time. My first question to you is going to be very basic. If you can, first of all, explain to us what monkeypox is and what symptoms do mild and severe cases have, and how do you differentiate the two?
So, as you already mentioned, it's a genetic viral disease, and the disease gets transmitted human to human when there is a closed contact where large respiratory droplets, which are like fomites or direct respiratory materials, generally requiring a prolonged close contact for getting transmitted from one person to another. It may be direct contact with any body fluid or lesions, and indirect contact with the lesion material, just like contaminated clothing or linen and that kind of thing. Some animal to and human transmission is also reported. Now, we need to first understand this is not something to get panicked of. It is a disease which is known, which is there, which is rare. Now, it's some outbreaks are happening, and our case identification and surveillance system is everything that we need to ensure that we combat this properly. Clearly, it is defined into three types of cases. One is a suspected case, one is a probable case, and another being a confirmed case. Now, suspected case mean a person of any age who had a history of traveling to the infected areas that we already know, where the within last 3 weeks, because incubation period although mentioned to be 5 to 13 days, but it can go up to 21 days. So if a person had such an history of traveling to any affected country within last 3 weeks and being presented without and with an acute rash without any explained reason, and with one or more additional symptoms like swollen lymph nodes, fever, headache, body ache, profound weakness. So, one or more of these with acute pustular rashes all over the body. If this happens, that is a suspected case. Now, the probable case is will be defined as all when all these are met and the person is clinically compatible with the illness, the symptoms that I mentioned, and also has an epidemiological link, means had a face-to-face exposure with a known case, more common for healthcare workers or those who actually deal with such patients without appropriate personal protected equipments. Direct physical contact with skin or skin lesions of such a case, including sexual contact, and contact with contaminated material, something like this. So, if there is known such a thing, that is considered as a probable case. And a confirmed case is when the DNA polymerase chain reaction results with or without sequencing finds the unique monkeypox viral sequence.
Okay, I want to come to precautions in a bit, but if you can first of all talk about transmission. I want to talk about human to human transmission because the WHO's guidelines say that the invasion period, which is 0 to 5 days, it's characterized by fever, back pain, etc., like you mentioned. But the skin eruption, and this is the WHO's guidelines, which says that it happens with 1 to 3 days of the onset of fever. So there are a couple of days before the skin eruption is seen, and the other symptoms before the skin eruption happens is quite common with other diseases as well. So how does one identify and know that somebody is already infected?
So first of all, as you rightly mentioned, there is a prodromal symptom period, prodromal syndrome period, and This prodromal syndrome starts with either fever or something like sore throat or something like this. And then infectivity starts 1 or 2 days before the appearance of rash. So, a person without rash may be a monkeypox patient, and that patient can infect other without having rash. So, that's the problem that you are highlighting very rightly. The point is, those fever and sore throat, if somebody is having fever, sore throat, and other symptoms of prodromal syndrome, like as I mentioned, and in the guidelines also, that if somebody is having any swollen lymph node or any kind of body ache or headache, which is actually disturbing. So lymphadenopathy and fever, this is from 0 to 5 days. Either lymph node will be swelling, fever will be there, it is behind the ear or in the axilla or in the inguinal region, maybe unilateral, maybe bilateral, with some headache, muscular ache, and chills, sore throat, cough. So all things related to those kind of any kind of these symptoms, if a person is having, the person needs to take care by drawing the attention of a healthcare provider.
So you're saying, of course, these symptoms shouldn't be ignored, but how do you not dismiss it as like a common cold or even COVID, for example?
Yeah, just 2 days of self observation will tell you, because rashes usually begin within 1 to 3 days of fever onset. So, if I am infected today and I don't know, and this kind of symptoms appear, because asymptomatic cases are not very common, so there will be some symptoms, and if the asymptomatic cases transmitting the disease is not well reported, so if I am having, even if a common cold, even if it is a fever, or if it is monkeypox, I just need to confine myself in an isolation for 1 to 3 days. And if no rash appears, that means it is not monkeypox. Just like if for the case that is identified in Delhi, there were tracing of several contacts, and none of the contacts actually developed any symptom over a period of time. But on the other hand, the case which was identified, that was identified after the rash. So in between the contacts were there. So whenever symptoms are there, one need to take attention or to draw attention of the healthcare provider, and then be under observation for 1 to 3 days. If no rash happens, it's fine. If it happens, it will anyway go off in 2 to 3 weeks. Just having that time period, because until all scabs fall off, the person remains infected as far as it is known. So that's why it will be important for being in isolation for that period of time.
Right. So that's a very important point that you made. Be in isolation, look at yourself for 1 to 3 days, and if rash appears, then it could be monkeypox. So, because I spoke about COVID, I also want you to draw differences between monkeypox and COVID in terms of transmission.
So for COVID, we already know, and this was actually debated initially, but later on it was kind of confirmed that there is airborne transmission also. So when I'm speaking, I cannot see, but a lot of materials coming out of micro materials coming out with my breathe. When I'm breathing, it is coming out. These are respiratory droplets, which don't travel more than 1 meter generally. So these materials, so when somebody is within a kind of a range of area of 3 to 6 feet, less than 6 feet, the transmission of this direct material is not possible. And direct transmission means when a particle from one person's respiratory system reaches directly another person's body. So it has to be either a respiratory particle or a fomite, which will be transmitted either directly or indirectly through any contaminated material, like any cloth, like any kind of body secretions, contaminating any materials used by the infected person. So these are the ways of transmission. And for any patient who is a known case, all these precautions to be taken, so that whoever comes in direct contact, especially for healthcare providers, they should be having properly equipped with the personal protective equipments, and all the contaminated materials should be properly disposed of as per the biomedical waste management guidelines.
Uh, and the other point that I also want to talk about is death occurrences. For instance, the WHO has now said that there have been 5 deaths so far. Is that something that we need to be worried about, because the WHO has said that it is rare?
So mortality death is actually reported to be very low. Historically, it has been seen that apart from some high risk population, that means who come in regular close contact with patients, it is actually generally much below, very close to 1 to 2%. And even in the highest level also, it has been known to be as high as 3 to 6% maximally.
Let's also talk about precautions then. And if you could divide it into three categories. One, you mentioned about the high risk category. So, the high risk category, including children, if you could talk about what precautions they must take, what precautions should the general public take, and what precautions should healthcare workers take.
So basically, all depends on how well we can track our cases. The way the international airports and people traveling from infected areas need to be identified, quarantined, and if any symptom is there, need to be actually isolated. That is the principal aspect for preventing the general community from general population from such a low transmissible rare disease. Now outbreaks happening, so that's why whenever there is a known case, one first of all, it all comes from person's own accountability. Any person who is having any kind of sore throat, fever, and lymphadenopathy should actually keep himself or herself indoor in isolation for 1 to 3 days to see if there is any development of rash. And at once also take some medical advice to ensure that if the rash appears before that unknowingly, the person doesn't come in close contact with these kind of people like the young children or those who are immunosuppressed or something. So that's why everything here is on personal accountability. Any person having symptom need to keep themselves in isolation, need to seek medical care, and any doctor reaching to any patient suspected or confirmed need to actually have them protected with proper personal protected equipments. And as governmental and the administrative system need to keep a proper reporting system in place, the integrated disease surveillance program of the country as well as the government reporting system should be integrated properly so that any case gets properly reported and close contracts traced.
Okay, also, what about vaccination? Because WHO has said that prior smallpox vaccination may result in milder illness. But there's a point that I would also for you to talk about, which is the advisory, which says that at the present time, the original first generation smallpox vaccines are no longer available to the general public. So, what's your view on vaccination?
Yeah, we all are informed as much as you just read. The original smallpox vaccine is no longer available. The other vaccinia vaccine based vaccine that we have for smallpox, that is not also available on the market but may be developed over time. Now there is no specific monkeypox vaccine so far. It's actually known that this smallpox vaccine is likely to work on the monkeypox vaccine also. I mean, on the monkeypox also, but it requires further research. As we are facing outbreaks, it's time to actually think of developing right vaccine and getting it ready for any larger outbreak if it is on the cards. Right now, I don't think there is any advisory for vaccination as we don't have any uh, available ones.
And do you believe that there will be a larger outbreak? Because while we're talking about vaccines, speaking to NDTV, Mr. Adar Punawala has said that Serum Institute of India is spending its own funds to import a few million doses of a Danish smallpox vaccine.
if
If
there is a
Yeah,
large.
Yeah, the Danish company has is in touch with the Indian institute, and there is a conversation ongoing. I know about it. The point is, there is a preparedness required, and that is required just because whether there will be a big outbreak or not, that's a secondary question. But we need to be prepared for those kind of things, and any potential infectious disease emergency can be prevented by two ways. One is this surveillance and action, and second is vaccination. So the vaccination for any such kind of multi-country small outbreaks need to be on the focus, because when we have multiple country having small outbreaks, that can actually together any time end up in a larger emergency. So that's why it's a less transmissible disease right now. It's actually still now the progressing very slowly. So the health system has the full chance and scope to address this through proper case tracking and parallel vaccine development.
All right. So, a couple of key takeaways that you mentioned. First of all, you said there's no need to panic at this point because India has four cases so far, but case identification and surveillance is the most important. But one piece of advice that Dr. Mahapatra said is that if you have any of the initial symptoms like fever, sore throat, etc., that appear within 0 to 5 days, you must confine yourself and look out for the rash before taking further action and consulting your doctor. Dr. Mahapatra, thank you so much for joining us and giving us your time.
Thank you.